So in esophageal and GE junction cancer, we typically use neoadjuvant chemoradiation with carboplatin paclitaxel, although some people use FOLFOX backbone with radiation as well. Patients go for resection, and then we now have the results of a phase 3 trial that you looked at the results of adjuvant nivolumab versus placebo after the resection of these tumors, and specifically looked at patients who had residual disease at the time of resection. So patients with pathologic complete response were excluded. And this trial, which was has now resulted a year ago, established a new standard practice in this setting. 1 year of adjuvant nivolumab significantly prolonged disease-free survival after the resection, and so now should be offered to all patients who have received these types of therapy. So this is our new standard in esophageal GE junction cancer. We do have an ongoing ECOG study, phase 2-3 study, which is led by Dr. Jennifer Eads. This is a cooperative group study that's open in the United States that asks the question, can we further augment on the results of this study? And this study looks at, has 2 points of randomization. It randomizes patients in preoperative setting to either chemoradiation with carboplatin and paclitaxel and nivolumab or standard chemoradiation. And then it has another point of randomization in adjuvant setting, and then randomizes also patients to either adjuvant nivolumab or adjuvant nivolumab and ipilimumab. And so the study is actively enrolling patients, and hopefully we'll be able to further augment on the signal that we have seen with checkmate 577. Of course, in gastric cancer, we approach the disease a little differently. In gastric cancer and GE junction cancer as well, we can also use perioperative chemotherapy. Standard practice right now is FLOT. And so in this meeting, we actually have seen some results from a phase 2 study where immune checkpoint inhibitors were added to FLOT, which we have seen increase in path CR rate with that approach. But the large phase 3 study, Matheron study, is ongoing to see whether immune checkpoint inhibitors will become part of the standard treatment in gastric cancer as well.